Hi, everybody. I have Dr. Thapa here. He is the infectious disease director at UPMC Western Maryland. He is going to discuss with us some questions that community members had about specific disease groups and some immunosuppressive therapies um, in relation to the vaccine.
Okay.
Okay, so the first question is for patients taking other immunosuppressive drugs like those for RA, Crohn's disease, is the vaccine safe?
So thank you, Jessica, for inviting me to talk about the safety and efficacy of the COVID-19 vaccine. As you're aware, we've started giving the vaccines to high-risk frontline workers as well as high-risk populations. But what I want to say is for the patients who are already on immunosuppressed, all the data is suggesting that it is as safe as any other vaccine. But the efficacy is something that we don't know if it's the same as the immunocompetent patient populations. But based on all the data that we have and the studies, uh, the side effect profile is minor, and there's no major concerns for these particular patient groups.
So what about for patients taking the medication PrEP? Would that be considered safe?
Yes. So what people have to realize is that, vaccine, like any other medication, has its own side effect profile. Most common side effects is, a sore arm at the injection site, and some people can have fatigue and body aches for 1 or 2 days. Very few cases of severe anaphylactic reactions, but overall, the risk is no different from taking any other medications such as Aleve or Tylenol, um, but there is no major concerns as to if something is contraindicated. That means these patients cannot receive it, and there's no such evidence that would support vaccines being contraindicated in this patient group.
Interesting. Okay. What about, we've had a few community members that have addressed concerns about the vaccine that have autoimmune conditions such as thyroid disease or Hashimoto's. Is it safe for this group to receive the medication, the vaccine as well?
Yeah, I can understand why some of these patient groups would be concerned. And, because when it throws in that word autoimmune, that means, your body is producing antibodies that target your own body parts. And there can be various triggers in the environment, and some of them are viral infections that can trigger such an autoimmune response. With the vaccine itself, there's no proven data that it causes some of the patients that already have autoimmune conditions. There are no major concerns that they cannot receive it.
Great. And then what about, you had talked about there are very minimal anaphylactic reactions. There have been multiple physicians encouraging patients, even with significant allergies to whether it's environmental or medications, to receive the vaccine. What are the risks of a severe reaction for patients that have more complex allergies and things like that?
Yeah. So again, there is a small risk that certain patient population could have a severe allergic reaction to the vaccine, but just because you have a history of prior allergic reactions doesn't mean that you cannot get the vaccine. And ultimately, I would encourage your listeners to weighing the risk of having the actual infection versus getting the vaccine that is protective and has very low risk. We already know that almost 340,000 Americans have died since the pandemic began. And until recently, there was one death every minute. So, um, for me, the choice is simple. If you had to choose between something that can be as severe, and it's not just for you, but you can pass on the infection to your family members who are elderly or immunocompromised, and they can have severe infection, be hospitalized, be in the ICU. So, and on the other hand, we now have a vaccine that can prevent this infection from spreading, and finally the pandemic can take a turn. So I would strongly encourage them that when it's their turn, that they should opt in for the vaccine.
Great. Thank you. That was really insightful. I appreciate you taking the time out of your busy schedule to meet with us today, and we hope to talk to you soon.
Sure, of course, anytime. Thank you.
Thank you.
Bye-bye.